Why do policies limit COPD, pulmonary rehabilitation access? Imagine trying to get the help you need for breathing problems and hitting a wall. That's often what happens with pulmonary rehabilitation programs for people with chronic obstructive pulmonary disease. Policies are a big reason why access isn't always easy. These rules are set up to manage healthcare resources and make sure treatments are safe and effective. But sometimes, they end up limiting the help patients can get. Pulmonary rehabilitation is a full program that includes exercise training, education about managing symptoms, and behavioral support. It helps people breathe easier, improves their quality of life, and boosts their ability to do daily activities. Despite these benefits, many policies restrict who can participate and how many sessions they can attend. For example, insurance plans like Medicare usually cover up to 36 sessions over 36 weeks. If a patient needs more, they often have to get special approval or meet strict criteria. Sometimes, they can get an extension to up to 72 sessions if their condition is very severe, but only if a doctor says it's medically necessary. Policies also set rules about who qualifies based on how bad the disease is and how much it affects daily life. Patients with very severe lung problems or those who are homebound might not meet the criteria, even if they could benefit. Repeat programs are rarely covered unless there are special circumstances, which can leave some patients without ongoing support. Another barrier is where programs are located. Rural areas often don't have enough pulmonary rehab centers, and transportation can be tough. This means even if someone qualifies, they might not be able to get there easily. Policies often don't prioritize expanding services in these underserved areas. Financial issues also play a role. Reimbursement rates for pulmonary rehab are lower than for other types of therapy, like cardiac rehab. This discourages many clinics from offering more programs or expanding existing ones. If providers aren't paid well, they might not be able to keep the programs running or make them accessible to more patients. Doctors' awareness and referral practices matter too. Sometimes, healthcare providers aren't fully informed about who qualifies or how to refer patients. This can lead to fewer people getting the help they need. Policies that requiring detailed documentation can make the referral process more complicated and discourage some providers from making recommendations. Finally, patient factors like anxiety, low health literacy, or ongoing smoking can make participation harder. Policies often include requirements for patient education and readiness, which can unintentionally exclude those who need help the most. All these policy rules are meant to balance cost, safety, and effectiveness. But they can also unintentionally limit access to a program that could really improve patients' lives. That's why advocacy and community efforts are so important to push for policy changes that make pulmonary rehabilitation more available and fair for everyone.